Do men still feel the urge to masturbate in their 70s and beyond? Or does sexual pleasure fade into the background as aging takes center stage? This is a question that many think about, but rarely discuss openly. In a world where youth and virility are celebrated, what happens when a man crosses the threshold into his later years? Does the desire for intimacy truly disappear, or does it simply evolve into something different? The reality is far more complex than society would have you believe. While younger men are encouraged to embrace and celebrate their sexual vitality, older men are often met with silence, or worse, the assumption that their sexuality is no longer relevant. But is this true? And if it's not, what does it mean for aging men who still experience sexual desire but feel pressured to suppress it? In today's video, we're breaking the silence. We're diving deep into a topic that is often ignored, the truth about male sexuality in later life. We'll explore the science behind sexual desire, the physiological and psychological changes that come with aging, and the surprising data that challenges everything you thought you knew about masturbation in older men. But we won't stop there. We'll also address key questions that could impact your health and well-being. Does sexual activity have benefits for older men, or could it pose risks? Is it possible to maintain a fulfilling sex life despite age-related challenges? What does science say about the role of testosterone, erectile function, and overall satisfaction in older men? And perhaps most importantly, what does this mean for you? There are a lot of myths out there, but this conversation is about facts, real experiences, and the untold truth about aging and sexuality. If you've ever wondered whether intimacy and self-pleasure still have a place in later life, or if you're looking for answers to questions you've been too afraid to ask, then you need to watch this video until the end. Because what you'll learn today might just change the way you think about sexuality, aging, and what it truly means to live a fulfilling life, at any age. Let's get started. If you haven't subscribed to our channel yet, I encourage you to click the subscribe button and ring the notification bell to stay updated on all our latest content. I'm eager to hear your thoughts on today's topic. If you enjoy the content, please comment 1 below. If it doesn't resonate with you, leave a 0. Your feedback is crucial as it helps me create better videos that align with your interests. Now, let's get started. As men step into their 70s and beyond, a deeply personal yet scientifically intriguing question arises. Do they still feel the urge to masturbate? Is sexual pleasure an ongoing aspect of their lives, or does it fade into the background, overshadowed by the inevitable changes of aging? And if they do continue to engage in self-pleasure, how does this align with the realities of growing older, particularly in the face of common age-related challenges such as erectile dysfunction, reduced testosterone levels, and changes in cardiovascular health? Beyond the biological aspect, what does it mean emotionally for an aging man to continue seeking intimacy, whether with a partner or through self-pleasure? These are questions that rarely make their way into public discourse, despite being relevant to millions of people around the world. What makes this topic even more compelling is the societal perception of male sexuality in later life. While younger men are often encouraged to embrace and celebrate their sexual vitality, older men are subtly, and sometimes not so subtly, pressured to accept the notion that their sexuality is no longer relevant. There is an unspoken expectation that, at a certain age, men should let go of their desires, put aside thoughts of intimacy, and focus instead on what is deemed age-appropriate behavior. But is this truly the case? Does the desire for sexual pleasure simply vanish after 70? Or is it merely reshaped by the physical and emotional transitions that come with aging? As someone deeply committed to uncovering the truth about male health and wellness, I have spent a great deal of time reviewing scientific literature on the subject. What I found was not only eye-opening but also deeply revealing about the misconceptions surrounding sexuality and aging. Unfortunately, this remains an area of research that is often overlooked or dismissed, despite its significance in the lives of millions of older men. Before I dive into the details, however, I want to take a moment to express my sincere gratitude to each and every one of you who are part of the UroChannel community. Your loyalty, curiosity, and engagement mean everything to me, and it is because of your unwavering support that I am more motivated than ever to bring important discussions like this into the spotlight. So, as we embark on another year together, I want to wish all of you a happy new year. This video, and this conversation, is for you. Now, let's talk about masturbation. Despite being one of the most natural human behaviors, it remains a subject that elicits strong reactions, ranging from fascination to discomfort, from curiosity to outright taboo. But why? Why does something as universal as self-pleasure continue to be wrapped in unnecessary shame, especially when the conversation shifts to men in their later years? Perhaps it is because society has long been conditioned to associate sexuality with youthfulness, virility, and physical stamina. As a result, the idea of older men engaging in sexual activity, whether alone or with a partner, tends to be met with skepticism, amusement, or even disapproval. Yet, the truth is far more complex. Sexuality does not suddenly disappear with age. It evolves. While it is undeniable that physiological changes occur, such as decreased testosterone production, slower arousal response, and potential difficulties with erectile function, these changes do not equate to a loss of desire. In fact, many older men report that their appreciation for intimacy deepens as they age. The frantic urgency of youth is often replaced by a more thoughtful, sensual approach to pleasure, one that is less about performance and more about enjoyment, connection, and self-awareness. For those interested in the deeper science behind this topic, I have previously uploaded a video exploring the evolutionary role of masturbation and why it has remained a consistent aspect of human behavior throughout history. If you haven't seen it yet, I highly recommend checking it out. Here's the link. Now, let's look at the data. In 2010, a comprehensive U.S. population-based survey analyzed sexual activity across an extensive age range, from 14 to 94 years old. This study, which included 5,865 men and women, provided valuable insights into the realities of sexual behavior across different life stages. When we focus specifically on men aged 70 and above, the sample size narrows to 184 individuals. The findings. On average, 27.9% of men in this age group reported masturbating within the past month, while an even more significant 46.4% had done so within the past year. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. To put these figures into perspective, let's compare them to a younger demographic. Among men aged 25 to 29, an overwhelming 68.6% reported masturbating within the past month, while an astonishing 83.6% had done so in the past year. The decline is clear, but what's striking is that nearly half of men over 70 were still engaging in self-pleasure at least once a year, showing that sexuality remains relevant well into old age. Fast forward to 2021, when Norwegian researchers conducted a similar study, this time involving 4,160 participants between the ages of 18 and 89. Of these, 342 men were over 70 years old. The results mirrored those of the earlier study, with 22.5% of men in this age bracket reporting that they had masturbated in the past month. While this study did not track activity over the past year, its findings further reinforce the idea that self-pleasure remains an active component of life for a significant number of older men. But here's where things take an unexpected turn. In that same Norwegian study, researchers discovered that men under 30 reported surprisingly low rates of masturbation. Only 4.5% of them had engaged in self-pleasure within the past month. This raises a compelling question. Could it be that older men, despite the challenges of aging, are actually more in tune with their sexuality than their younger counterparts? Is it possible that, with age, comes a greater appreciation for the body's ability to experience pleasure, an awareness that younger men, caught up in the distractions of modern life, may overlook? Beyond statistics, another key consideration is the potential health benefits and risks of masturbation in older men. Some studies have suggested that regular ejaculation may be linked to a reduced risk of prostate cancer. Others indicate that sexual activity of any kind, whether with a partner or alone, can play a role in maintaining cardiovascular health, reducing stress, and promoting better sleep. However, for men with underlying health conditions such as high blood pressure, heart disease, or diabetes, questions remain about whether sexual activity could pose risks. Could masturbation place unnecessary strain on the heart? Could it trigger sudden blood pressure fluctuations? These are crucial areas that warrant further research and discussion, rather than silence and stigma. Equally important is the emotional and psychological aspect of sexuality in older age. Masturbation is not just about physical release. It is about self-care, stress relief, and maintaining a sense of normalcy in one's sexual health. For men who have lost a partner, whether through divorce, separation, or widowhood, it may serve as a way to maintain intimacy on an individual level. Even for those in long-term relationships, self-pleasure can coexist with a healthy and fulfilling sex life with a partner. The key takeaway here is that aging does not mean the end of sexual expression. It simply means that it changes. So, where do we go from here? The conversation about male sexuality in later life needs to change. Instead of perpetuating outdated notions that sexual desire has an expiration date, we must recognize that intimacy is a lifelong journey. No one, regardless of age, should feel ashamed for embracing their sexuality. Instead, we should foster open, informed discussions that acknowledge the full spectrum of human experience, from youth to old age. Let's continue this dialogue with curiosity, with honesty, and most importantly, with the understanding that no matter how many years we have lived, we all deserve the right to explore, express, and embrace our sexuality without fear or shame. If you are still watching this video, and find these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Now, you might be wondering, why does this happen? Why do some men maintain their sexual interest well into their 70s and beyond, while others seem to lose it entirely? I'll get to that in just a second. But before we dive into the why, let's put this phenomenon into perspective with some hard data. Among all men who do engage in masturbation, there is a striking contrast in frequency between younger and older age groups. According to recent statistics, a notable 17.55% of men under 30 reported masturbating daily, a testament to the high levels of sexual drive that typically accompany youth. Meanwhile, among men over 70, that number plummets to just 0.6%. This drastic decline is often used as evidence that sexual desire inevitably fades with age. But does it really? Or is there something more complex at play? At its core, masturbation is commonly linked to sexual desire, but the reality is far more nuanced. In 2020, an extensive meta-analysis was published in European Urology Focus, compiling data from 75 different studies, a monumental effort to understand how male sexuality evolves across the lifespan. The findings were both illuminating and surprising. One of the key visuals from that analysis is a box plot illustrating sexual desire across different age groups. What does it show? Well, unsurprisingly, sexual desire declines significantly in old age, but here's where it gets interesting. The variation between individuals is massive. In fact, the data shows that between 16% and 80% of men aged 70 and older still experience sexual interest. That's right. Some men in their 70s and beyond continue to have a strong sexual drive, while others experience a steep decline. The takeaway: age alone is not the determining factor of sexual desire. There is great individual variation, which means that just because someone is in his 70s, 80s, or even 90s, it does not automatically mean he has lost all interest in sex. On the flip side, while desire varies widely, erectile function does tend to diminish with age. Another key finding from the European Urology Focus analysis was a box plot showcasing the prevalence of erectile dysfunction, ED, in older men. The data revealed that between 8% and 94% of men over 70 experience some degree of erectile dysfunction. Once again, we see an enormous range, meaning that some men retain near full function, while others experience significant impairment. However, when you break it down, the numbers show that roughly 70% of men in this age group have some form of erectile dysfunction. Many people assume that losing the ability to achieve an erection equates to losing the ability to experience sexual pleasure. But this is a myth. In fact, Orgasmic function is an entirely separate physiological process from erectile function. This means that an erection is not a strict precondition for orgasm. It is entirely possible to achieve orgasm without having a full erection, something that is rarely discussed but is absolutely crucial for older men to understand. This brings us to a very important point. The way men perceive erectile dysfunction changes with age. Among younger men, the inability to achieve or maintain an erection can cause intense psychological distress, leading to anxiety, depression, and even avoidance of intimacy altogether. However, as men age, their emotional response to ED shifts significantly. Here's what the numbers tell us. Among men aged 60 to 70, the percentage of those bothered by their erectile dysfunction is up to 70%. However, among men over 80, this number drops to 38%. This suggests that, over time, many older men learn to adapt to changes in their sexual function. Rather than seeing ED as a catastrophic loss, they often develop new approaches to intimacy, placing less emphasis on penetration and more on connection, pleasure, and overall sensuality. This shift in perspective can be incredibly freeing and allows men to continue enjoying a fulfilling sex life in a different way. The hidden reasons behind masturbation in older men. Now, let's talk about why older men masturbate. While many assume it's purely about sexual gratification, the truth is that the motives for masturbation are far more varied than most people realize. Even scientific research admits that there is still much to uncover in this area. One of the most compelling findings comes from the Norwegian study we discussed earlier. The researchers discovered that there is only a loose correlation between the frequency of masturbation and overall sexual satisfaction. This means that just because a man masturbates often, it does not necessarily mean he is sexually fulfilled, and vice versa. Another fascinating study, involving 20,967 men, uncovered something even more revealing. Many men report masturbating not out of sexual frustration, but as a way to cope with anxiety and stress. This aligns with what we already know about the psychological benefits of sexual release. Orgasm triggers the release of endorphins, oxytocin, and dopamine, which help combat stress, improve mood, and even promote better sleep. So, while masturbation is often seen as a purely physical act, it can also serve as a powerful form of self-care and emotional regulation, something particularly relevant for older men who may experience higher levels of loneliness, stress, or health concerns. The most important takeaway: use it or lose it. Now that we've explored all this information, what is the key takeaway for you? It boils down to one fundamental truth: use it or lose it. Sexual function, like any other bodily function, is subject to the principle of disuse atrophy, meaning that if you stop engaging in sexual activity altogether, whether with a partner or through masturbation, your body may gradually lose the ability to perform these functions altogether. This is one of the reasons why many sexual health experts encourage older men to maintain sexual activity, even in the absence of a partner. Regular sexual activity, including masturbation, can help maintain blood flow to the genitals, preserve nerve sensitivity, and keep sexual reflexes active. While it cannot prevent all aspects of age-related decline, it may slow down the process significantly. I have personally encountered many patients in older age groups who, after years of sexual inactivity, suddenly found themselves in a new relationship, whether through dating apps, rekindled romances, or unexpected connections. But after long periods of dormancy, their bodies struggle to restart sexual function. The reality is, once a man stops engaging in sexual activity for extended periods, it can be extremely difficult to regain that function later on. Final thoughts: breaking the silence around sexuality and aging. At the end of the day, what we need is a cultural shift, a new way of thinking about male sexuality in later life. The outdated notion that men over 70 should simply accept the loss of their sexual selves is not only false, it is harmful. Sexuality is a lifelong journey, and for many men, it remains an essential part of their identity, well-being, and quality of life. Rather than avoiding the topic, we should be having more open, honest, and science-based conversations about how to navigate sexuality as we age. This means addressing the biological, psychological, and emotional aspects of sexual health, as well as challenging the stigma that still surrounds male sexuality in later life. So let's keep talking. Let's break the silence. And most importantly, let's give men of all ages the permission to embrace their sexuality without shame or fear. The irreversible changes in penile architecture. What you need to know. As men age, one undeniable reality is that biological changes occur in the structure and function of the penis, many of which cannot be reversed once they take hold. This might sound unsettling, but it's a natural part of the aging process, much like the gradual loss of muscle mass, reduced skin elasticity, and slower metabolic function. These structural changes, often due to reduced testosterone levels, decreased blood flow, and connective tissue alterations, can affect the ability to achieve and maintain an erection, impact sensitivity, and even alter the physical appearance of the penis. Over time, the elastic fibers in the penile tissue become less flexible, leading to a noticeable reduction in length and girth in some men. Additionally, the buildup of plaque in the arteries, atherosclerosis, can restrict blood flow, further contributing to erectile difficulties. But does this mean that men are doomed to lose all sexual function? Absolutely not. While these changes may be inevitable to some extent, they do not necessarily mean that sexual pleasure, intimacy, and even sexual activity must come to an end. In fact, one of the most misunderstood aspects of aging and male sexuality is the fear of decline leading to avoidance, when in reality, continued sexual engagement, whether with a partner or through self-pleasure, may help maintain sexual function for longer. Is masturbation harmful to health? This is a question that has circulated for centuries, often steeped in misinformation, superstition, and even fear-based narratives. So, let's set the record straight. No, masturbation is not harmful to your health. In fact, it can be beneficial. Masturbation has long been studied in relation to mental, emotional, and physical well-being, and the overwhelming conclusion from scientific research is that it is a completely normal, healthy behavior at all stages of life, including old age. However, like anything in life, balance is key. Let's break down the major benefits of masturbation, particularly for older men. Improved blood circulation. As men age, circulation to the pelvic region tends to decrease, which can contribute to erectile dysfunction and loss of sensitivity. Regular masturbation helps stimulate blood flow, which may promote better oxygenation and overall penile health. Reduced risk of prostate issues. Some studies suggest that frequent ejaculation, whether through sex or masturbation, may help flush out toxins from the prostate, potentially lowering the risk of prostate cancer. One well-known study from Harvard found that men who ejaculated more frequently had a significantly lower risk of developing prostate cancer compared to those who did so less often. Stress and anxiety relief. Orgasm releases endorphins, oxytocin, and dopamine, which are natural mood-enhancing chemicals. These compounds reduce stress levels, promote relaxation, and even improve sleep quality, something that becomes increasingly important as we age. Maintaining sexual function. Just as physical exercise helps maintain muscle strength and flexibility, masturbation can help preserve sexual function. The saying, "use it or lose it," applies here. Regular sexual activity may help keep the neurological and vascular pathways active, reducing the severity of erectile dysfunction in some men. Pain relief. Orgasm has been shown to have mild pain-relieving effects, particularly for joint pain, headaches, and muscle aches. This can be particularly beneficial for older men dealing with arthritis, back pain, or other chronic conditions. But what if you no longer feel like engaging in sexual activity? Here's an important message. Sexual activity naturally declines with age, and that is completely normal. If you no longer feel the desire to engage in sex or masturbation, there is nothing wrong with you. If you are still watching this video and find these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Society often places too much pressure on men to maintain an aggressive or youthful sexual drive throughout their entire lives. But just as our dietary preferences, hobbies, and energy levels change with time, so does our relationship with sex and intimacy. For some men, the desire remains strong well into their 70s, 80s, or even 90s. For others, the interest fades, and they find themselves less drawn to sexual activity than they were in their younger years. Both experiences are completely valid. There is no single correct way to age, and no one should feel obligated to maintain a level of sexual activity that does not align with their personal comfort, happiness, and health. The bottom line: sexuality in older age is highly individual. What is pleasurable, desirable, or necessary for one man may not be the same for another. And that is okay. What about the heart? Is masturbation risky for cardiovascular health? One of the biggest concerns for older men, particularly those with heart conditions, high blood pressure, or a history of cardiovascular disease, is whether sexual activity, including masturbation, could increase their risk of heart-related events, such as heart attacks or strokes. The short answer: the risk is generally low. Sexual activity, including masturbation, is not inherently dangerous for men with heart conditions. However, it does involve temporary increases in heart rate and blood pressure, similar to moderate physical activity. If you are capable of engaging in activities such as climbing a flight of stairs, walking at a brisk pace, or performing light exercises without discomfort, you are likely able to engage in sexual activity safely. That being said, every individual is different, and some men may have specific cardiovascular concerns that require additional precautions. This is why it is crucial to consult with your doctor, not because masturbation itself is inherently dangerous, but because it is always best to understand your personal health risks and make informed decisions. If you have recently experienced chest pain, shortness of breath, dizziness, or other concerning symptoms, or if you are taking medications that may affect blood pressure or circulation, speaking with a healthcare professional is the best course of action. Final thoughts: embracing a balanced perspective on sexuality and aging. As we conclude this discussion, I want to leave you with a powerful and essential message. Your sexual health is yours to define. The societal expectation that men must either be sexually active forever or completely asexual after a certain age is both misleading and harmful. The reality is far more complex, personal, and diverse. Some men continue to experience strong sexual desire well into their later years, while others gradually lose interest. Some find new ways to experience intimacy, while others prioritize companionship and emotional connection over physical pleasure. There is no one-size-fits-all approach. However, if maintaining sexual function is important to you, staying engaged, whether through sex, masturbation, or other forms of intimate connection, can play a crucial role in preserving sexual health. At the same time, if you no longer feel the need or desire for sexual activity, there is no shame in embracing that change and living your life on your own terms. What truly matters is understanding your own needs, making informed choices, and rejecting the outdated belief that sexuality has an expiration date. So, whether you continue to engage in sexual activity well into your later years or find that your focus has shifted elsewhere, remember this: you are in control of your own journey. Age does not define your worth, and your choices should always align with what makes you feel healthy, happy, and fulfilled. And as always, if you have concerns about your heart, your sexual health, or any other medical issue, consult with a trusted healthcare professional. Your well-being is what matters most. Let's continue breaking the silence around sexuality and aging, because every stage of life deserves to be embraced without fear, shame, or limitation. So, now that we've uncovered the realities of male sexuality beyond 70, let's take a moment to reflect. What have you learned today? Has this conversation changed the way you think about aging, intimacy, or self-pleasure? Maybe you've discovered something surprising about how sexual desire evolves, or perhaps you've gained a new perspective on the importance of maintaining sexual health as you grow older. Now, I want to hear from you. In the comments below, share one thing you've learned from this video and how you'll apply it in your own life. Whether it's a new understanding of the science behind aging and sexuality, a realization about societal misconceptions, or even a commitment to embracing self-care without shame, your thoughts matter, and they can help others who might be struggling with these same questions. And if you found this discussion insightful, don't keep it to yourself. Write heavy check mark like this video to help spread awareness. White heavy check marks, share it with someone who might benefit from this information. White heavy check mark, subscribe to our channel and turn on notifications so you never miss another deep, thought-provoking discussion about health, wellness, and aging. Thank you for being part of this conversation. Remember, sexuality doesn't have an expiration date, only outdated beliefs do. Keep embracing life, keep asking questions, and keep taking care of yourself. I'll see you in the next video.